own Kim Pesaturo, who is our Assistant Dean for Assessment and Accreditation at Western New England University. She is going to talk about ways to motivate our Gen Z students. So without further ado, I'll let Kim take it away.
Awesome. Thanks, Heather. And thank you all for being here today on your, hopefully on your lunch break. I wanted to start by doing a little self-reflection before we got into the heart of today's talk. And so I have this bingo. This is Gen Z bingo. I'm sorry, Gen X bingo. This is my generation's bingo. So feel free to have a little fun with it. Let us know in the chat if you can claim bingo. I know, wore a flannel shirt over a band tee. I probably did that over the weekend. But some of this stuff just cracks me up when I think back to what we did as teenagers or college-age students. I definitely died of dysentery a number of times, and we're going to talk more about that in a minute. And so today's presentation is called No Cap, Real Ways to Motivate Gen Z Students. And No Cap comes from a dialect, but it's kind of taken over the internet and the TikTok space as slang for no lie or for real. So if something's cap, it's a lie. And so for real, we're going to talk about how to motivate Gen Z students today. So for our objectives, we're going to describe characteristics of Gen Z. So really, who are we looking at when we talk about this population, and how can we get them engaged and, in the workflow and excited about what they're going to be doing with us on IPPEs, APPEs, and beyond. And so I want to start with this pretty cool graphic, although I have to be honest here and say I have no idea what the source of this is. This came to me over my Instagram account, and I did validate this against some other sources, so I'm pretty sure it's accurate, but I'll throw that caveat out there. But look at this breakdown by generation. I always thought about, we had the baby boomers, the silent generation as going back, but to really think about the fact that this is not a new concept, all the way back to the Arthurian generation of 1433. And so what we're looking at here, I would assume most of us fall in these categories. I would assume that on this presentation, and feel free to jump in otherwise, we're looking at baby boomers, Gen X, and millennials for the most part as precepting today's students. We have this sort of overlap or this crossover, which is the Oregon Trail generation or the Zennials. And that is sort of where we have a population of preceptors, really, and even students potentially, that started in an analog age but grew up into technology within their childhood. So that's why it's sort of that crossover generation. And as far as Gen Z, sometimes termed our homelanders, we're looking at a date of birth or somewhere in the generation of being born between 1997 and 2011, 2012, you're going to find that the ranges vary. We're also now moving into Gen Alpha. So we're getting, but these students they're not in pharmacy school yet. So we have a little ways to go before we see Gen Alpha come down the pipeline for us. And so this is just a little bit further detail on what the generations look like. And so again, Gen Z, 96, 97, this is going to be when they're born after. And when this graphic actually came out, this was in 2020, there was no defined chronological endpoint for Gen Z. But like I said, now we have Gen Alpha. So we have added a generation in the past 4 years. We've got our millennials. And again, these numbers are from 2020. So just to put that in perspective. And Gen X, you see this 1980 to 1981, it sort of overlaps. And then again, in here is where you tend to find that Zennials or that crossover generation. And so why is this topic important? What was sort of the driving force behind me wanting to come to you today and talk about this? What we're seeing now with our practitioners, with our practicing pharmacists, is that we are struggling with current demands of life and work and struggling to maintain that elusive work-life balance. We as a whole, so everyone sort of millennial down or millennial back, seem to be pretty vulnerable to burnout. And so what we're trying to do is trying to understand how to train the next workforce. And I don't want to say to replace us, but just to be considerate of the fact that we are, as a whole, pretty overworked, overstressed, and overdemanded. So we need to reinforce the new generation and learn how to support them appropriately. And I want to offer, as I go through these slides, feel free to jump in. Dom, if you don't mind just monitoring the chat, let me know if there are any questions. Feel free to unmute. This is a very open conversation. So what does the Gen Z childhood look like? How did these students grow up? Well, for one, they grew up in times of socioeconomic uncertainty and complexity. They've lived through market crashes, housing crashes. They've lived through unsettling times of, in the state of the world, wars, unsettling elections. However, they have been educated in diverse and inclusive settings. So while they've had this sort of uncertain background growing up, moving forward, we're actually doing pretty good with their education. And so they've been educated in settings that highly promote DEI principles. And they've had very involved parents. One of the terms that I was familiar with growing up, and I want to apologize, I don't know if this is viewed in a negative light, but was as a latchkey kid, where you were just kind of allowed to go home and let yourself in the house. Now we're seeing very involved parents. The terminology has extended to the quote helicopter parents, which again, maybe not the best or most appropriate term, but these are parents who have been overly attentive and overly fearful for their children because of, these uncertainties, these complexities, the state of the world. And so before we can motivate our own Gen Z students, it's critical to understand who they are and how they've grown up. So one of the things we know about Gen Z is they are more racially and ethnically diverse than any previous generation in the US. We can see here that 1 in 4 members of Gen Z are Hispanic, just as an example. And this statistical breakdown, this is a general view of the United States, but this does vary by region of the country. So geography does play a role into this, and I don't have that breakdown here for you today. But our Gen Z students are slightly less likely than millennials to have immigrated to the US. So we're looking at students, for the most part, that whose parents may have immigrated to the US if they were not born in the US. But these Gen Z students are more likely to be born of immigrant parents. Does that make sense? All right. Gen Z is a generation growing up with support. I was a first-generation college student. I think my parents, who, they tried to do their best, really didn't have any idea on how to navigate the college system with me, but we're seeing that change now. We're seeing that Gen Zers are more likely to be enrolled in college, but also to have a college-educated parent than millennials or Gen Xers at comparable ages. And so what this means is they're on track to be the best educated generation we've seen to date. They're also less likely to drop out of high school, and they're more likely to enroll in college. And this bodes really well for colleges that struggle with things like recruitment and retention right now. As I mentioned, they're more likely to have a college-educated parent, as seen here. And what we know is that second generation or beyond college students are more likely to succeed in the college environment than our first generation college students. So overall, the trend for Gen Z is we are pushing towards the higher education model. But interestingly, because they're more likely to be involved in their education, they're less likely to be working during college. They tend to have a much more singular focus. So Gen Z students as a whole, as a trend, take active roles in their own lives and their own social issues. And this is likely to play a role in how their education plays out. And we're going to talk about that momentarily. But they seek meaningful activity rather than social prestige. They seek activism. They want to participate in activist activities. They want an activist government. Gen Z and millennials have fairly similar viewpoints on the big issues of the day, but they have widely differing viewpoints from their elders. And so that is interesting. They see family and societal change, for example, non-traditional marriage situations as one example, as good for the future of this country. And they have never known a day without Google. So these are our digital natives, right? These are students that have never known a time or can't remember a time before smartphones. Think about that. 97 was probably the time where your first big brick of a smartphone came out. I think I had a Nokia with a keypad on it. Most current Gen Z teens are almost constantly on social media. And so you can see that, almost half are almost constantly on social media, including things like YouTube being the biggest platform that they're on, but several times a day to less often. We're encompassing pretty much the whole generation. They know how to survive, thrive, and educate in the confines of this social media driven world. And I would venture to guess here that this is where millennials and previous generations have struggled a little bit to sort of find their way in this digital world. But now we're seeing the whole era of digital natives come ahead. They know what to do. They know how to be in this world. So now that we know who they are, what is driving them to a career in medicine? Well, for one, interest in the field. And so as activists, like, keep in mind, that's who they are, right? They want that, they have that inherent drive for social change. And they're highly motivated within their settings of interest. And so medicine incorporates that, right? It's a very activist type field. They also have an attachment to meaningful work. Like I said, they'd rather make change than acquire social prestige. They are looking for things like income and job security, but the income and job security motivation is coming more from the instabilities they've likely observed growing up than their need to be wealthy and exhibit wealth. And so this is, again, versus previous generations where prestige has been a big driver to the medical career. I don't know how many of us, when we were young, were hearing that the medical doctor was sort of like the top profession. And, that's such a fallacy, right? But it is something that somewhat gets ingrained in you as this societal driven career of prestige. We're not seeing that with Gen Z. We're seeing things like Doctors Without Borders, and we're seeing a lot of that activism type work. And so once you get Gen Z into the medical force, they are altruistic. They're very intrinsically motivated. They're high performers, they're career-minded, and they love and thrive on teamwork. And so when you think about these attributes, you want to think about using these things to your advantage when you're designing educational activities, especially on IPPEs and APPEs, because if you can put that student on a team rather than focus on the individual and sort of the sense of loneliness, if we can combat that, we're going to have much better outcomes. Ethical cases are a good thing to drive this generation when you think about activities to engage them in, challenging assignments, career discussions, having them work with others. So there's ways to use this to our advantage. And we know that they're showing less concern, again, over that extrinsic prestige or extra professional concerns. This is a generation that is not worried about the fact that they may have children someday and may have to have a career change, or may have children someday and may want to work from home for a little bit. We thought about that. I thought about that as a Gen Xer. I did that. I spent 6-7 years at home mid-career raising my children. You're not seeing that concern here. Now, with the caveat that this generation is still young. And I don't know that you can realistically say anybody's thinking about that when they're, 16, 18 years old. But it's less of a concern than in previous generations. It's not coming down generationally as it was before. What we've seen with Gen X is they have what's called a high sense of coherence. And coherence is this recognized, validated measure of someone's ability to respond to stress. This is in contrast to previous generations. And it's not well defined how contrasted it is to previous generations, but we just know that Gen Z individuals have a better stress response than their predecessors. And so this measures the extent to which somebody is likely to see a stressor and say, you know what, I can make sense of this. It's fine. It's all in a day's work. And I am worth overcoming this obstacle. My career, my happiness, my sense of satisfaction is worth pushing forward. And a lot of times that translates to grit As an outcome, these students they're gritty, right? They can keep pushing through obstacles. And so this having a high sense of coherence enhances their ability to say, okay, look, there's a problem right now. What am I going to do about it? They can mobilize their resources much better than previous generations. And so coherence, or having a high sense of coherence, looks like this. It incorporates three principles. One is comprehensibility. So these students see events in their lives, even the traumatic ones, as having meaning. And what meaning can they pull from these? So they view this way rather than seeing events as random or chaotic and the next thing that's happening to me. They see events as manageable because these are just bumps in the road. They're just stressors. We can figure a way around them. And they seek meaningfulness out of the events. So somebody passes away on their rotation, a patient passes away. What meaning can I derive from that? What lesson can I take and bring that to the next patient case I encounter? And so there's a lot of self-reflection and self-evaluation that comes with this generation. And so this is more of a general construct of what having a high sense of coherence looks like. But essentially, you start with, is the sense of coherence high or low? And we go through these three items that we just discussed. And the questions kind of trace down like this. Is the event tolerable or intolerable? Can you trust what's happening, or do you lack trust in what's happening sort of in your environment and in the event? And then how do you face it? Do you face it with a sense of zest, or does it further or increase your sense of depression? And what we're seeing is these are tolerant, trusting, zestful individuals. I feel like this is all a really good thing, to be honest. When I started looking into this topic, I wasn't quite sure what I was going to find, and what it's showing is very promising. So if you want to start to have this coherence discussion with your students, you may want to think about how coherence is measured and think about how you can incorporate those types of questions into your interactions with your students. And so if you want to have a meaningful conversation, it's okay to bring in items like, modifications of these, I would say, but do you feel that you're being treated fairly in this setting? And if not, how can we change that? Are you experiencing something that you'd rather not feel, and how can we work through that? How often do you feel there's little meaning in the things you do in your life? And what should happen is, if you score this out, the students that score high on this have a high sense of coherence. But these can be questions that you just sort of take off the cuff and do a deeper dive with when getting to know your student on an APPE or an IPPE. Because this can be a starting point to help support your students' psychological needs. And so when we support our students' psychological needs, what happens? Well, the student's going to internalize everything that's important to them. They're going to be able to self-reflect on what they value and what their important perspectives are. And any amotivation or demotivation, or sort of that controlled self-regulation where I'm not really going to show you my whole self, that's going to start to shift. When we can support these students psychologically, we can pull them out of that demotivated space and get them engaged, get them motivated. And then this self-determination and satisfying motivation occurs. This is an intrinsic process where they're saying, you know what, I really do like this and I want to be a part of this. And if you've ever heard me speak in a preceptor development conference, I probably sound like a broken record right now, but this comes from self-determination theory, which is a social theory, a psychological theory that says students or people have three basic needs: the need for autonomy, competence, and relatedness. And relatedness, in a lot of ways, is about becoming that parental figure to the students, because they had highly involved parents and now they're with you learning. And so they look for that same type of comfortable relationship. And so where we might see, emails that are not super professional, they sound like the students texting, a lot of times it's not a reflection of not being professional, it's a reflection of wanting that relatedness or seeking that sense of relatedness. And so how can we force or drive this forward with students? We're going to do things that enhance their curiosity. And so in an experiential situation, what do they want to get out of it? That's important to know. That goes hand in hand with providing choice. Using non-pressuring language, rather than, I assigned you this for tonight, go work on it. Look, I'd like us to take a moment and consider how this plays into this. Let's work on something tonight and report back tomorrow. They want to talk about their values. They want you to listen openly. They're not judgmental. They don't want you to be judgmental, right? But they need clear direction. They want details. They want a roadmap. They want challenge. All right. So don't be afraid to give them challenge, because that helps satisfy that intrinsic motivation. They want greetings, right? So it's this comfort of, good morning, how's it going? They want to be able to address you by name. And so sometimes, in Dr. Pesaturo doesn't really fly on a nappy rotation with this generation, because it's, I'm like sitting here going, call me Kim. They want to be treated as equals, and they want praise where praise is due, but they want to be able to offer praise as well. And so when we think about supporting their autonomy, we can focus our language to help engage them and help motivate them. And so if we say things like, that comparison you made was very interesting, that supports their autonomy, versus saying that comparison was exactly what I wanted you to describe. So that's very preceptor centric, right? So we're putting it on the student. If we say, go ahead and choose your groups and roles, versus I'm going to assign you groups and roles, we're supporting that autonomy, that sense of choice. If we say you have an hour to complete 4 items for this lab, it gives them a sense of control over their time, versus you have 15 minutes per item to complete 4 components. And that's such a minor shift in attitude, but it really does create a sense of control. And then something as simple as correcting with a green pen or a blue pen or a pink pen versus with the red pen, right? Red denotes harsh criticism, and we're trying to get away from that. And so when we support their psychological health through all of these things, we allow for advancements. Again, we challenge them, we direct and support them, we praise and credit. We enhance communication by having this type of dialogue, and we limit hierarchy through the roles embedded in teamwork. So once all this happens, you're going to see a healthy motivation or a healthy engagement come out of your student, because they need that support for their psychological health to get to that point. And finally, we can think about intellectual challenge. And so ways in which we can provide the challenge they need, this to me is a great list. We can practice high demand teaching. And high demand teaching is where, rather than giving the right answer to a student, we're going to kind of dance around the right answer. So we're going to ask a pointed question, and then we're going to say, okay, well, what if the situation changed like this? How would you then vary your answer? So we're going to dance around an issue, shift our focus slightly, and explore how they arrived at the answer. So tell me your thought process around that. How did you get there? Rather than saying yes, no, right, wrong, move on. We're going to use goal setting, and goal setting is hard. Goal setting is something that I'm now pretty well into my career that I feel like I'm just now getting a handle on. I think we all remember times when we were asked the question of, where do you want to see yourself in 5 years and 10 years? And you're going, what? Better at my job. I think it's really hard to quantify your goals. And so work with your students to help them set SMART goals, right? Specific, measurable, attainable, relatable, timely, and revisit the goals with them often, especially throughout, the 3 or 6 weeks of an APPE, for example. Self-evaluation, we want to help promote this with the student, because this again is going to maximize their sense of autonomy and responsibility, thereby supporting self-determination theory. With incorporating public-facing activities, this can be anything from public speaking. So I'd like you to, we're not even going to say I'd like you to, but how about, would you like to present on this event in front of this provider group? Would you like to work with this group of patients to help manage their diabetes in this care setting? And so getting them engaged in public-facing education is actually a really great way to support this. Encourage a growth mindset. So a growth mindset is the belief that we can do better and we can be better through hard work. And this comes in contrast to a fixed mindset, where a fixed mindset says, oh, I hit a stumbling block, I'm never going to be any good. You know what? I just stink at this. Like, I'm not going to be a good pharmacist. And so encouraging that growth mindset is a great way to be. And then finally, leveraging their digital nativity, right? So leveraging the fact that these students are all about technology, and maybe we can be too. And you know what? I'm not. Look, I'm the first to admit this is what my calendar looks like. So I am half in technology and half out as part of that Zennial generation. But we can challenge their natural skills. They can teach us, right? How can you incorporate, and this is the easy example, right? The low-hanging fruit. How can you incorporate AI into this and get someplace with this? How can we examine it through this technological lens? So leverage what they know through the incorporation of authentic assignments. Don't just have them write out and answer and email it to you. Have them vlog it. Have them do a podcast. Incorporate AI in meaningful ways. Have AI answer a medically oriented question and then sit down together and deconstruct it. And so take advantage of what they know. They're probably going to end up teaching you in a lot of ways. And so in summary, this is who we're looking at. We're looking at a diverse, educated, active, enlightened group. These students are probably going to be very easy to motivate because they already have that high sense of intrinsic motivation. So we can support them through application of the self-determination theory, through this provision of autonomy and intellectual challenge. And so that was a very brief, very generalized overview of Gen Z, but I'm happy to answer any questions to the best of my ability. And if there are none, I just appreciate your time today. And I hope you have fun with this new generation of students.
I have a question about like holding them accountable when like best way to provide constructive feedback.
So they seem to be well informed for self-evaluation. As far as holding them accountable, so if something's not getting done, I think probably the approach here is to have the sort of the real conversation as to why. What's holding you back from getting it done, and how can we work through that? How can we view that as an overcomable obstacle? And a lot of times you get to the root of things that are unexpected or surprising. Sometimes it's sort of this critical sense of, I want to do better and I'm working hard, but I'm afraid, so sometimes you kind of uncover these things. Otherwise, it could just be time management. Well, that's an obstacle we can overcome together. Let's work on setting out a calendar. So I think, to me, having just a very real conversation with these students is going to get you a better answer than deduction of points or sort of that negative reinforcement. Or even having that sense of control or autonomy and saying, well, what's a schedule that's going to work for you? What's a realistic timeline I can expect this in? And how might that play into the future scenarios with your jobs? So it's this give and take.
Thank you.
Does that answer your question, Melissa?
Yeah, it does. Thank you.
No problem.
Kim, this was super helpful. Can you go back a couple of slides? There was a slide that had like a bunch of points on it, and you back that one, this one. Okay. Yeah, that one. I just want to take a picture of it because it's stuff I'm actually gonna like try. Like I'm like totally interested and intrigued and want to really, try out some of this additional stuff. So, which I think I do, but I don't like, I definitely don't do all of that stuff, and can certainly change my lens in view of, how these things are presented. So super helpful. Thank you so much.
Thank you. And Kim, this paper down here, if you caught the reference in your picture, is so good at explaining how to do this. It breaks it down into like really straightforward detail. So I would suggest go beyond this and just go pull this reference. It's awesome.
Sounds good. Thank you.
No problem. All right. So there are no further questions. I guess we can wrap up, but you have my email. It's just kimberly.pesaturo@WNE. And
oh, I have one more question about treating them as equals. So in the clinical setting, you're definitely not equals based on like level of schooling, the degrees, like the licensure. So how do you do that like on an appy?
So for that, I would say it sort of goes into the like entrustable professional activities, right? And so because these students respond to challenge, I think it's fair to say to them, these are sort of the steps you need to take to get to point A, B, or C, or X, Y, and Z, and watch the student go through those levels. So clearly they're not equals in terms of, well, let me run this clinical concept off you and give me your professional opinion, which we can do as long as we have the right answer in our heads. But I think this question about equality comes more from the perspective of, call me Kim. And if you have a problem, I'm going to sit down and hear about it. And if, I'm going to try to be invested in your day versus everything's just going to get directed from me to you in terms of like, here's my curriculum, you go do it. I think it's more about having that choice and having that sense of, what are our mutual goals and how can we align in a process?
Thank you so much.
You're welcome. Thanks for the great questions.
Appreciate your time
Of course.
and expertise.
Thanks.
I have a question. It's kind of a silly one, but what I've really noticed with hang on, I can turn my camera. Hi.
Hello.
So I think one of the things that I've really noticed with Gen Z, and it's a minor thing, but we have a lot of like dress code problems. And I guess I'm just wondering if you came across anything about this and like maybe what dress code we can expect. Or I work in a hospital setting, so crop tops are, maybe questionable.
Well, that's a great point. And I would say a lot of that stems from the fact that they see change and they see this like forward movement and self-expression and individualization as being beneficial to society. And so you do get students that are coming in, my daughter is like this, right? My daughter goes to high school and she's wearing a shirt and I'm like, your whole stomach's hanging out. But it has become much more acceptable in like pre-secondary education. So I think that's part of our battle too, is they're allowed to wear it to high school in a lot of these situations in middle school. I don't know that I have a great answer, except sitting down and let's go through the dress code from a perspective of why this sort of means safety, right? So it's not that you can't wear open-toed shoes because we're afraid of looking at your feet. It's because we're afraid something's going to get dropped on you. We're afraid of needle sticks. We're afraid of injury. So I think for them, it's going to be a lot about the explanation and wanting to know the why versus previous generations that have probably just gone on to accept it as, well, I'm a rule follower and these are the rules. So I don't have a great answer for that, but I think that's how I would approach it.
All right, thanks. It's just, I think it's a conversation I've had to have several times in the past, like just couple of years versus ever having it before. But like you said, I have boomer parents, right? Like, you see your shoulders at work? What?
It's so true.
No tank tops, no open-toed shoes. I don't know. I guess it changes.
It does. It absolutely does. And they see this as self-expressionism and individualism. And it is something we kind of have to, as a profession, I think, stand against. But I think when we dig into the why, it becomes a lot of safety and how you want to project yourself as that professional. And even just highlighting to them that they're dealing with other generations, right? A lot of our patients tend to be older for the most part. And so how is that viewed? If I think if they know that it limits how they're viewed from a professional standpoint, that could even be a motivating shift for them.
All right, thanks.
No problem.
Well, I know we are past our time now, but we really want to thank you all for joining us, and thank you, Dr. Pesaturo, for presenting today and sharing your knowledge with us. Our next one will be in March, and Dr. DeFilippi will be sending out the invites for that and the save the date email. We do really appreciate all of you joining us, and we hope you have a wonderful Valentine's Day.
Take care. Thank you.
Thank you.